Perfect. Thank you. All right. Now we can get started. All right. So just to provide a little bit of context about the OEC 360 provider portal, this was a vision of our commissioner and the deputy commissioner. So we had held listening sessions. Geez, now it was not last year, it was a year before that we had held these listening sessions with the center providers as well as a few family childcare providers. And what we had heard is that there's no central location or a single place for all of these systems that the provider has to log in to give access to the providers in a centralized sort of way. So that was the idea behind these behind this portal. And what this portal does is it provides a read-only view of the data and information that's in the impact system, in the birth to 3 system, which does not pertain to the family childcare homes, but just know that there is stuff from there as well. The ECE reporter system, the background checks information system, early childhood information system, the home visiting system for the OEC, the Elevate, and the licensing information for all of the inspections and investigations and those kinds of things, as well as information from the professional registry and the core CT, which is the financial system that the state uses. So it has all the payments that have gone out to the provider. And all of this information is housed in a single login that gives you access to all of these things in one place. Thank you, Shane. I'm just waiting for my visual cue that Shane has finished talking, and then I can talk in English. All right, so I'm just sharing this as a rollout timeline, just so you can appreciate the path that we've taken so far and how mature our system has become over time. So the first rollout was for the centers, and it was on August 29th of last year. We started out with 10 providers, and then we found things that we had to fix, and so we did. And so then the next rollout after that was for 100 providers in October. Then November, we rolled out to more centers, and then to more centers, and then we had a full rollout on January 9th. All right. The next thing is for the family childcare rollout. We had the first phase was in March, and we rolled it out to 15 providers. And lo and behold, we thought that family childcare would be just similar to the centers, but it was not. So we found some new issues that were reported by this group of folks. And now, today we're here, and we're rolling it out to, it says 20, we're rolling it out to about 26 providers in this session. Then we have plans to roll out the next set of 600 providers. We have it over here, but it obviously depends on how much we find from this group that needs to be fixed before we can do the next rollout. And then if there are not anything much, then we can roll it out to 600, and then we'll do all the remaining providers, family providers after that. Okay, Catherine, over to you.
Thank you, Dhwani.
You're welcome.
So as Dhwani mentioned, we did listening sessions with providers in the summer of 2022 now, I believe. And we took the feedback from those listening sessions and built them into this phased pilot and made our expectations around the use case that we felt would be the best experience for providers. So the 4 elements of the OEC 360 that we really wanted to incorporate into the build, we wanted to have a test run with the phased approach, as Dhwani mentioned. So we started with 10, 100, 1,000 to really make sure that any initial feedback was being edited, revised, so we could continue to roll out the best product. We also have job aids and resources. So in addition to this webinar, we have PDFs with screenshots of the system and step-by-step guides about how to work through it. We're also going to be available for weekly office hours. So we'll be available for any questions as you're working through the system. And again, the main goal of this is to continually improve the product and make it the best experience possible for providers. And I'll pause there, please.
Now Jill will walk us through the actual OEC 360 provider portal experience. So I'm going to stop my share here, Jill.
Thank you, Dhwani.
Before we go on, are there any questions or comments in the Spanish room? Shape?
Okay. So your process for this will begin by receiving an email. You will receive an email from Sandbox OEC Provider 360, and it will be titled Sandbox OEC Provider 360 Verification Code. In this email, it's going to take you to the portal. What you'll need to do is click on the portal box, the blue highlighted box. Don't delete the email because you're going to need to come back to this verification code later. When you click the portal box, it's going to take you to a screen that looks like this. If the first screen is this. If you'd like to switch the language to Spanish, you're going to click on language and it'll allow to have a drop-down menu and it will allow you to change the language to Spanish. I do want to add also at this time, you don't have to remember every step of this. You will get a copy of the instructions with the screenshots in English and in Spanish immediately following this webinar. The next stage, once you click on your language, if you scroll down, you're going to come to this page right here. Now we're going to take two paths here. If you have ever set up a ct.gov account, maybe to pay your taxes or to register your car or get a license, you're going to use that ct.gov login. If you remember that login from creating your ct.gov account, please go ahead and enter the username and password and click login. If for whatever reason you forgot your username and password, like you know you created the account, but you can't remember what you created as, you can click on username or password and it will get you that information. Okay, so I'm going to scroll past this because we'll get back to that. We'll get back to it once we get everybody logged in. If you have not, right now I'm going through the PDF instructions. Later I'm going to go to the live section. Okay, so if you've never created an account, instead of entering your email address or username and password, you're going to click sign up now. When you do that, it's going to bring you to this page. So it's going to ask you to enter your first name, the last name, your username. I'm going to increase this a little bit because I can't see it. Your username, your email address. You're going to confirm your email address. You're going to enter your mobile telephone number, which is optional. And then you can select your language here, English or Spanish, and enter a password and confirm your password. And then you'll click the blue button on the bottom to submit the information. Once you do that, it's going to bring you to a page where it's going to list your first name, your last name, your username, your email address, your preferred language. Make sure this is correct. Click the I am not a robot box, and then click submit. Once you do that, it's going to take you to a page and it's going to ask you for a verification code. You're going to go back to the email address that you used to sign up and you will have gotten a new email. With that email, you pull the verification code out of the email and you enter it into this box. Don't use the verification code from the first email you got inviting you. Use the second email that is giving you a new verification code.
Diana, did you have a question?
Hello? Yes, I do. Can you hear me?
Yes.
Yeah, so I think if you check the chat, the few providers to say like they have an account. I have my account too. And actually I reset the password, but it's not working. It says there was a problem.
Well, so first of all, are you using your BCIS login?
Yes.
This is not a BCIS login. So
Oh,
you
no,
will
the CT.
ct.gov.
Yes,
Okay, so you're using your ct.gov and it's saying that it's invalid.
exactly. It says there was a problem. And actually reset the password because I thought it was, I did something wrong. But I tried again and it says there was a problem. Login fail, reload the page and try again. And I see another provider on the chat who says that she's having the same issue.
Okay. What we will do is we will reach out to you individually and we will have to check your screen because while I know kind of what you're explaining, I don't know the exact situation. So we will have to look at our backend system, look at your login, and then we'll be able to help. But
Okay.
I'm seeing the chat that others are also having this issue. So once we figure out what's wrong with one, probably that will be the same case that needs to happen to everyone. So I will ask Shane actually is our help desk support person. So he will call you, Diana, if you don't mind.
Yeah.
Then we can get through this, okay?
Okay, perfect. Thank you.
You're welcome.
So once you enter the verification code, you will hit submit.
Jill, Shane is interpreting.
Oh, yeah, that would be a good thing. I'm so sorry, Shane.
Okay, he's good.
We're good? Okay, so once you hit submit, it will bring you to a screen that says success, that you've successfully created your account. So what you're going to do is you're going to go back to the email, the first email address you got from the portal. Don't anybody get dizzy. I'm going to take you back up here. So you're going to go back to the first email address you got from the portal. You're going to write down the first verification code you got in the very first email. Then you'll come back to the login page and you'll use the login that you just created to log in to the account. At that time, you will see this screen. You'll notice that you're not connected to any programs. If you'd like to connect to a program, you click the Connect More Programs button. And it will bring you to this page where it's going to ask you to verify your identity. What you're going to do is you're going to type in your program name. So whatever is, and Jelani, correct me if I'm wrong, but whatever is on your license is what you will type in, correct?
You can also just view the email that you received. You should have received an email this morning
Yeah.
inviting you to use the portal. So Jill, if you go back up to the very top where,
Yeah.
or this one, yeah. See how it says the program name is Marion YMCA Childcare. So that the email references the name of your program, but it is your Family Childcare Home program name from our system.
So make sure you write down not only the code, the verification code, but the name. And it's very intuitive. If you start typing your name in here, it will automatically show up. And this is where you're going to enter the verification code from the very first email that you were sent. So like Dwani said, you were sent an email this morning. Enter the verification code from that email and then click next. That will bring you to the terms of agreement page. You'll read the terms of agreement, click the box, and then click submit. I want to pause and tell you I'm not being rude by not looking at the screen. My camera is here, but my presentation is over there. Just so you all know, I'm not ignoring you. Thank you, Shane. So then once you've successfully done that, it will bring you to this page that tells you you have successfully linked your program to your account. At this point, you can click Go to My Dashboard. And now we're in the live system, no more PDFs. So I will take you through the different components of the dashboard, and then we'll get into your program. So we have, obviously this is your dashboard. There'll be action items right here. So for example, according to my action items, my Care for Kids health and safety orientation is not compliant, which means that I have not completed, or it has expired. Maybe my CPR and first aid is expired, or my admin meds have expired. That is listed there. If you have background checks that are going to be expiring, they'll be listed there. There'll be action items that are listed there for you in the action item area. Up above, if you go to About OEC, it will provide you with all the different links to the different areas on our website that talk about OEC. The next one is provider resources. These take you links directly, again, to the OEC website. We have how do you become an early childhood teacher, Elevate, our emergency planning and response, resources, professional development, technical assistance, resources for state-funded and ECE providers, and supporting children's learning and development. The next one, we have program services, give an overview of all of OEC's programs and services. Birth to 3, Care for Kids, our CCDF, our Child Care and Development Fund, home visiting, and state-funded early care and education programs. The next one is a link to our licensing, which gives you an overview of licensing. There's a link to tutorial videos, how to apply for a new license, how to look up programs and providers, how to renew your license, the regs and forms for childcare centers and group homes, as well as family childcare, youth camps. And then there's an area for education consultant applications, and then the statutes and regulations. And then we have background checks. Obviously, this takes you to information about our background checks. There's an overview of BCIS. It takes you through the steps on how to get a background check, where there's videos and PDFs to support you. There's an area about out-of-state background checks. Then there's an area on how to use the BCIS roster as an administrator that includes videos and helpful handouts. There's news on background checks. And then if you get help, it will take you to an area where you can find resources to complete your background checks. And then the help button, if you click here, it will take you to the provider help desk. Just so you know that the provider help desk is the same one that you use for BCIS. When you log into log your ticket, you will choose the topic that you're putting a help desk ticket in for. So, for example, somebody mentioned a problem earlier. If we weren't on this call and you wanted to get help quickly, you could submit a help desk ticket and Shane would get that and he would work through you with that. So that takes care of the resources at the top. At any time, if you are in the portal and you want to go back to the dashboard, come back to this page, you would click on My Dashboard. Manage Provider 360 Access. This is where you can invite someone who's part of your program. So somebody who's on your roster, your BCIS roster, maybe your older daughter, your husband, or somebody who lives in the home and you want to give them access. You can provide them 2 types of access. What you do is you'll click invite and it'll ask you what level of access you'd like to choose for them. Level 2 can invite other staff. So if you'd like to have someone who you trust, who it's kind of like your BCIS roster, someone who you trust, who will provide access to new family members, maybe you know that, or maybe you have substitutes, that individual, if you give them level 2 access, and when you click invite, it will ask you what type of access you would like to give them. You will give them level 2. And if you just want somebody on there who can log in and look at their their account, look at something, you can give them level 3. You typically wouldn't want to give household members that really don't have a registry account or don't have anything that they would really access, but it's up to you on how you manage your business. And then if I go back to my dashboard, notifications, this is not up and running yet.
Jill,
Yep.
if you go back to manage, Shane still needs to interpret that.
Oh, Shane, you got to keep stopping me because I keep going. Thank you, Shane, Vani. I'm just going. All right, so if I want to go back to my dashboard, I will click my dashboard. And here you'll find notifications. This is not up and running yet, but eventually the vision is to have any email that is sent to you from OEC to also live here. And it'll have the date, the subject, the attachment, and it will give you some details about the email. This will prevent you from having to go search through your emails from an email you know you got from OEC, but you can't remember where it went. This would have been very helpful during COVID when we were getting COVID memos constantly, but it will keep all of your emails in from OEC in one place, and you can go back and reference them if you need to. Thank you. So now we're going to get to look at your program. I'm going to click back to dashboard, and I'm going to go into my test program, and all I have to do is click view summary. This will tell you that this tile gives you information. It tells you that my license number is active. My license is active. It will have the name of my program here. My registry ID will be here, and then the license number will be here. To access your program, you're going to click view summary. And it will bring you to this page. Again, your name of your center will be here, your license number, your registry number, your address, and then access to program summaries, enrollment summaries, payment summary, professional registry summary, and for some reason my dashboard never has BCIS, but there is one down here for BCIS. So we're going to start with program summary. To access this tile, you click the down button, and it will bring up 4 tiles for your viewing. Your state-funded early care and education. There's something important I want to point out. If you look up in the upper right corner of each one of these tiles, it tells you the last time it was updated. So if you update something in the registry or in one of our systems, it's usually not going to show up immediately. It usually updates overnight. So for those of you, and I'll go over this really quickly because there are not very many state-funded spaces in FCC. We have some, and in the future we envision having more, but I will go through this. So this program, My Family Child Care Center, has a total of 41 funding spaces in the state-funded early care and education. If I want to go to the EC application, which is our EC reporter, I would click here. I'm not going to go there. I'm going to click here on view details, and this will take me to a page that is going to talk about the grant awards I have from the state for either school readiness or CDC. So if you will find as you open most of these tiles, you can filter, use the filters above to search. All you have to do is hit apply once you type what you want in here. And if you want to reset them, you'll hit clear. According to this, I am funded for 24 preschool, 24 full-time preschool sites, set spaces, 15 infant toddler spaces, and two additional infant toddler spaces. Obviously, that's more than 6 children. This is just a demo. Group homes and childcare centers would not, family child care would not have that many. But it just tells me what I am funded for, or what my grants have been awarded by the state. I'm going to go back to my dashboard. Click my program again. And find myself back at program summary. And we'll talk about e-license.
Hey, Jill,
Yes,
in
ma'am.
the interest of time, would
Yeah.
you just click to elevate? Because I don't want to lose that, because that's what.
So you're going to talk through, because I don't understand. I don't think. Yeah. Okay.
We'll pass the ball over to Dina.
Okay.
We good? I can certainly jump in and talk about
Yes, go
Elevate.
for it.
Okay. So, and I know a lot of people are here, and this is the part they were really wanting to hear about. So, again, for any of you, once you're in this provider portal, we had talked with many of you about accessing this portal first, and then you would start the process to submit your Elevate plan. And as Jill demonstrated, it showed in that first tile. And for a lot of programs, they're not going to have multiple sites, because a lot of these are family providers, obviously. So they'll just have the one, and more than likely you'll see Elevate pretty quickly. So you're going to then click on that, and it will show here where you can start that process. So it looks like there's one here for this program in process. So, and I guess that's a good place. We can start there. For anyone that decides that they want to create a plan or start a plan at any time, if you want to stop, or you need to break, or whatever, or you're not really sure on the answer and you want to step away from it, you can always save it, get out of it, and come back into the plan. But for the Elevate program plan, we do have some resources. We have a template that many of you have, but it's also on our website, that runs through all the questions. So you kind of have a heads up of what you're going to be submitting. So for here, for example, somebody in this test started an in-progress plan. So you can click on edit, and it should bring up, again, the information on your getting into your program, making sure all the information is there. And then you can click on, is that what it brought you back to, Jill, when you clicked on that for in progress or submit for
This
Elevate?
is in progress. Yep. This is
Okay. So then we can go into the Elevate program plan. And it really kind of runs down now. The biggest part of an Elevate plan is your SMART goal, and that's always the first place that you want to start. So it does allow you to enter in the tile where you can click on, it says add a SMART goal. You could click on there, and that's where you would type in what your goal is. Anytime you have to edit anything that you want to add, if you don't like, you can certainly remove and take that information off.
Dina, let's let Shane
Yep.
catch.
Yep. Mm-hmm.
Okay, Dina.
So for the Connect with Families, can you click on the edit? Thanks. So here is where, again, all the information that we would want to see you fill in here. It's starting with, we give obviously a definition of a SMART goal and what a SMART goal is. And then you would see where it says focus area. And if you click the little arrow down, it's going to give you a few different options, and you do want to pick a focus area. And again, connecting with families, building your team, anything like that. Your focus area is going to align with your SMART goal. So if you pick connecting with families, and then your goal is going to be having to do with connecting with families. So here it says building a system of communication for families by September 24. That is your SMART goal. So you have enough space here to write however much you want to put in there, but you want to make sure that you're meeting the definition of a SMART goal, which again is listed up top, that little pop-up that you got, explaining again that a SMART goal is specific, measurable, achievable, relevant, and time-bound. And if at any point you're not clear on what you should be putting here, you can reach out to either your staff family childcare network, hub, or one of the service navigators.
Do you want to?
And then we have, again, you'll see drop downs for action steps. You can enter the steps that you're going to take in order to achieve the goal, your current reality, challenges or barriers, anything you feel that you might run into in order to achieve the goal, you would fill out here, including same with resources. Who will do this? This should always be usually, well, the person who's filling out the plan. So in this case, it's always more than likely going to be you. So you're going to put in your information here, but you can also include if you have a substitute or assistant, and you can give us a general idea of a date that you think it's going to be achieved. It doesn't have to be anything like exact, and it's just a roundabout. It'll take you 6 months, it'll take you a year. We just like to have an idea of when you think you may be able to achieve it, and how you're tracking that progress is also something that if you'd like to fill in as far as, doing a check-in on those goals every 2 months, every other month, however you want to do it. That's going to be also an important piece to this Elevate plan. And then anything you put in here, just make sure you hit the save button. That's important. Remember to hit that, because all the work that you've just put in may not save. So you want to make sure you click that button at the bottom that says save. Then I just want to point out that if for family childcare providers that are generally, I think most of you on this call here today, the next two tiles, the professional program professional development plan and education professional development plan, are not required. So they shouldn't show up when you are logging in as a family provider. So that's not something you have to do. So pretty much it was the first part to the Elevate plan that you're going to submit. Once you hit save, it then bounces to us, and you should be aware, and if not, you are assigned a service navigator based on your location. Many of you have already been given that information of who that is, but we do review those plans. If we have any questions or concerns, you'll get an email sent to you letting know whether or not your plan has been accepted, approved, or denied, and then we give feedback as well, and also are willing to set up a time to meet with you, but that will all come through correspondence via email. And so again, what will happen is if it is approved, a lot of you are also aware that we currently have an incentive going on for the first 125 approved Elevate plans. You would be eligible for incentive of $1,480. And we are reaching out to those programs and those providers to let them know if they've met the incentive. So if you aren't sure about that, you'll get information, but your approval, denial, approval, or any correspondence, again, will come via the portal, and a connection with your service navigator, if necessary, can happen as well. So that's, it's a new system we're all rolling out, but any questions, and I know there's some in the chat, I'm kind of trying to monitor that too. So we are more than willing and able. We do have office hours also set up that can also speak to some of these questions that have come up, but we're also available if needed. So that's pretty much the Elevate. And I would say to many of you, if you can look on our website, because we do have the template there as well as far as questions that you need to complete. So that's first 125 approved Elevate plans that come through the system are eligible for the incentive, yes.
Bonnie, where do we go from
Okay, so Jill, if you just want to go back, like hit the back button. One more time. Yep, the other thing that I would highlight over here is the payment summary, Jill. Just very quickly, folks, I know we're running out of time, but if you're interested in seeing a previous history of all the payments that your family childcare provider received, then we do have two areas. One is the OEC payments, and then the other is Care for Kids payments. So if you received Care for Kids payments, then it will be under the Care for Kids category. Otherwise, all the other payments that you may have received through the OEC for stabilization funds, or this Elevate payment that you will receive, all of those things will be under the OEC payments. So if you can just click Jill after Shane does his interpretation. Go ahead, Jill, if you can hit view details.
Like Dewani said, here we'll list any payments that you received from OEC. These are not Care for Kids payments. If you click OEC, you'll see OEC. If you click Care for Kids, you'll see Care for Kids. There's the payment ID, the payment type, the amount that was paid, the invoice number, the total that it was paid, the description of paid, and there's a message in here. And it will tell you, like, there's a code there. And if you are immersed in OEC payments, you'll be able to tell what that code is. If you're not, you can always call and ask what the payment was for. And then I'll show you what Care for Kids payments look like. Okay. Care for Kids payments will show you your Care for Kids payments that you received. They show the payment ID, the day it was issued, the gross amount, the payment status, and the total family fee for that goes along with that payment. If you are ever, again, wanting to search, you can search by payment ID here. So if you know this child's payment ID, the child's payment ID, put it in here. The status you can put here, has it been canceled, in progress, and the dates if you can't remember when a payment was made or you have to search for a payment.
Jill, if you can just once show help again, so that folks are aware if they need to file a ticket, how they can go ahead and just click on that and open in a new screen probably, so that if they're not able to log in, then they're not going to get that menu bar to click from. So it is this link, and I'll also put it in the chat over here so that everyone has it handy.
So if you want to put a help desk ticket in again, you would go to the help up at top, click this, and it'll bring you right to our help desk ticket. You may be familiar with this from using EC Reporter or from BCIS. And all you're going to do is click open a new ticket, put your email address, your full name, your telephone number, and you're going to click a topic. And if it's for the Provider 360, you click this and it opens all of this up. The more information you put in here to start with, your program name, your registry ID, your license number, and your role, the more information Shane has to get the answers to get back to you. If you don't fill this out completely, he's going to have to come back and ask you for information, and you're going to go back and forth a couple times. So providing him with the most information up front will yield you the best results.
Okay. Oh, Shane, are you done? All right, great. All right, great. Well, thank you everyone for joining us this afternoon. And like we said, if you have any specific questions, feel free to reach out to us via the help desk, which makes us track all of the queries that we're getting in one place, so that if there are system improvements that are needed, then they're all in one place that we can access. All right, without further ado, have a good afternoon, everyone. Thank you.
Thank you, everybody.
And thank you, Shane. Take care, everyone.